Good afternoon and good morning, everyone. My name is Catherine Rippey, and today I'll be presenting on Medicare and the marketplace. This session focuses on the health insurance marketplace, sometimes called the marketplace or the exchange, and other provisions of the healthcare law and what people with Medicare need to know. This training module was developed and approved by CMS. The information in this module was correct as of July 2016. This is an informational resource for our partners. It's not a legal document or intended for press purposes. Official Medicare and the Marketplace program legal guidance is contained in relevant statutes, regulations, and rulings. In today's presentation, we'll cover the following topics and how they pertain to people who are eligible for Medicare. We'll talk about Medicare eligibility and enrollment, necessary enrollment decisions, the Medicare and Marketplace transition, and then we'll end today's presentation with a list of resources. So first, we're going to cover Medicare eligibility and enrollment, which will be a review for most of you. It's important to review this information, however, so that we can set the stage for how this affects Marketplace enrollment. So let's start by discussing when enrollment in Medicare is automatic. If you're already getting Social Security or Railroad retirement benefits, you'll automatically be enrolled in Medicare Part A and Part B without an additional application. You'll get your initial enrollment package, which includes a Medicare card and other information, about 3 months prior to turning 65 or 3 months before your 25th month of disability benefits. Medicare coverage begins the first day of the month you turn 65 or your 25th month of disability benefits. If you're not getting retirement benefits from Social Security or the Railroad Retirement Board and you want to enroll in Medicare, you must sign up to get Medicare. And we'll talk about the periods when you can enroll later. Now, if you aren't getting Social Security or Railroad benefits at least 4 months before you turn 65 because you're still working, for instance, as I mentioned before, you'll need to sign up for Part A if you want to enroll in Medicare. You should contact Social Security to apply for Medicare 3 months before you turn 65. If you worked for a railroad, you'll contact the Railroad Board to sign up. It's important to note that although the age to receive full Social Security benefits is increasing, Medicare benefit eligibility still begins at 65. So when to enroll? Your first and most important chance to enroll in Medicare, especially Part B, is during your initial enrollment period, or your IEP. Your IEP lasts 7 months, and it begins 3 months before you turn 65 and ends 3 months after you turn 65. If your birthday is on the first of the month, your IEP is 1 month earlier. This means that your IEP begins 4 months before you turn 65 and ends 2 months after you turn 65. First, we'll talk about enrolling in Part A. If you're eligible for free Part A, you can enroll in Part A once your IEP begins, typically 3 months before you turn 65, and any month afterward. You usually don't pay a monthly premium for Medicare Part A coverage if you or your spouse paid Medicare taxes while working. This is sometimes called premium-free Part A. If you're not eligible for free Part A because you or your spouse didn't pay Medicare taxes, you have to pay a premium for Part A, and you can only enroll in Part A during your IEP or during the limited Part B enrollment periods that we'll discuss later. The first time you can enroll in Medicare is at the beginning of your IEP. During your IEP, you can enroll in Part A and Part B, and we'll talk about Part B and Premium Part A first. Only people who don't qualify for free Part A must pay a premium for Part A coverage. You must pay a monthly premium for both Part A and Premium Part A coverage. Your Part B or Premium Part A coverage will start on when you enroll in it. If you enroll during the first 3 months of your IEP, your Part B coverage will begin the first month you turn 65. If you enroll the month you turn 65, your coverage will begin the first of the next month. If you enroll in the last 3 months of your IEP, your coverage will begin 2 to 3 months after you turn 65. These delays are required by law. If you don't enroll in Part B or Premium Part A during your IEP, you may have to pay a lifetime penalty. If you're eligible for free Part A, you can enroll in only Part A at any time after your IEP starts. If you enroll in free Part A during any month of your IEP or 2 months after your IEP ends, your Part A coverage will begin the first month you turn 65. If you enroll in free Part A later, your Part A coverage will start 6 months back from the date Social Security determines you're eligible. This is also required by law. You can't pick your free Part A start date. The date free Part A begins is important for people who can contribute to a health savings account or an HSA because they can't deposit money in their HSA for 6 months before their Part A start date. This is also important to keep in mind for people who may choose to delay Medicare in favor of marketplace coverage. So if you didn't sign up for Part B or Premium Part A during your initial enrollment period, you can enroll during the general enrollment period. For most people who don't enroll during their IEP, this is the only chance to enroll in Part B. The GEP occurs each year. It begins January 1st and ends March 31st. If you enroll in the GEP, your coverage will start on July 1. This is required by law. In addition, if more than 12 months pass since you turned 65, you'll likely have to pay a lifetime penalty that is added to your monthly Part B premium. This means that your monthly premium will be higher than if you signed up during your IEP. And the longer you go without coverage, the higher the penalty. There are a very few special enrollment periods for Part B and Premium Part A enrollment allowed by law. Now, most people don't qualify for one of these special enrollment periods. However, if you're still working, you may be eligible. An SEP allows you to enroll after your IEP and not wait for the general enrollment period, and you won't have to pay a penalty. If you didn't sign up for Part B or Premium Part A during your IEP, you may be able to enroll during this SEP. The SEP is limited. To be eligible, you must have group health plan coverage based on active and current employment. If you're 65 or older, you must get this employer-sponsored coverage based on your or your spouse's current employment. If you have Medicare based on disability, you can also have employer-sponsored coverage based on a member's current employment. Now, it's important to note here that COBRA, retiree coverage, long-term workers' compensation, and individual marketplace coverage, or VA coverage, is not considered active current employment. To qualify for this SEP, you must have group health plan coverage for all the months you are eligible to enroll in Part B but didn't. For most people, this means you had group coverage since you turned 65. You can enroll using this SEP at any time while you have group health plan coverage based on active current employment. If you lose that group health plan coverage or the current employment, then you have 8 months to enroll in Medicare. If you don't enroll within the 8 months, you'll have to wait until the next GEP to enroll, and you'll have a gap in your coverage and may have to pay a penalty. So marketplace consumers can choose to delay Medicare and stay enrolled with the marketplace, but terminating marketplace coverage doesn't provide an SEP to enroll in Medicare, which could lead to gaps in coverage. And we'll discuss further that there are important considerations to keep in mind, including designated Medicare enrollment periods and the possible late enrollment penalties that we've already discussed. We'll talk more about making the decision to delay Part B enrollment later. So let's discuss each of these enrollment decisions in detail. As we discussed, if you're receiving Social Security or Railroad retirement benefits at least 4 months before you turn 65, you'll be automatically enrolled in free Part A. If you don't get Part A automatically, you should consider signing up for Part A when you're first eligible during your IEP. If you aren't eligible for Part A and you don't buy it when you're first eligible, your monthly premium may go up 10% for every 12 months you didn't have the coverage. You'll have to pay the higher premium for twice the number of years you could have had Part A but didn't sign up. The 10% premium charge will apply only after 12 months have elapsed from the last day of the IEP to the last date of the enrollment period you used to enroll. So in other words, if it's less than 12 months, the penalty won't apply. This penalty won't apply to you if you're eligible for a special enrollment period. But remember, you're only eligible for a special enrollment period if you or your spouse is actively working and covered by a group health plan through the employer or union based on that work, or during the 8th-month period that begins the month after employment ends or the group health plan coverage ends, whichever happens first. If you're still working or have coverage through a spouse, it's important to talk to your employer benefits coordinator to learn how enrolling in Medicare or delaying enrollment will affect your employer coverage. You can no longer contribute to an HSA if you have Medicare. So you want to talk to your company's benefit administrator about when you should stop contributing to an HSA if you plan to sign up for Medicare. You may have to stop contributing to your HSA up to 6 months before your Medicare starts. You can still withdraw money from your HSA after you enroll in Medicare to help pay for medical expenses like deductibles, premiums, co-payments. But if you contribute to your HSA after and you have Medicare, you could be subject to a tax penalty by the IRS. If you have a marketplace plan and you sign up for Medicare, you will not be eligible for any tax credits and or reduced co-payments and co-insurances that you may be getting through the marketplace. So when you must have Part B? You must have Part B if you want to buy a Medigap or a Medicare supplement policy, or if you want to join a Medicare Advantage plan, if you're eligible for TRICARE for Life or CHAMP VA, if your employer coverage requires you or your spouse and family member to have it, which is less than 20 employees, and you would talk to your employer or union benefits administrator to figure this out. Veterans benefits are separate from Medicare. With veterans benefits, you may choose not to enroll in Part B, but you will pay a penalty if you don't sign up for Part B during your initial enrollment period. If you have VA coverage, you won't be eligible to enroll in Part B using the special enrollment period we discussed before. You must have Part A and Part B to keep your CHAMP VA coverage. So now that we've reviewed those important enrollment decisions, let's discuss how they apply to individual marketplace coverage. This section will focus on the individual marketplace and what people who either have Medicare or may soon be eligible for Medicare need to know to make informed healthcare decisions. This information is provided to help ensure that this audience is aware of how those decisions could affect individuals' coverage and possible penalties later on. So the health insurance marketplace is designed to help you find and buy health insurance that fits your budget, but it generally isn't a place for someone with Medicare to look for healthcare coverage. We will explain when people with Medicare may have coverage in the marketplace and when they can't. And we'll talk about what someone might need to know about the marketplace as it relates to getting Medicare prescription drug coverage or Part D. There is a marketplace for small employers too. It's called the Small Business Health Options Program, or SHOP. We'll briefly talk about SHOP later. Some people who are eligible for Medicare could have employer coverage through the SHOP. And lastly, we'll cover information about help paying Medicare costs for people with limited incomes and resources. So again, as you know, Medicare isn't part of the health insurance marketplace. So if you have Medicare Part A, you have what we call minimum essential coverage, or MEC, which means you won't be subject to the individual shared responsibility payment, sometimes called a tax penalty, for not having MEC. If you only have Medicare Part B, you don't have MEC. The marketplace doesn't change your Medicare plan choices or your benefits, So no matter how you get Medicare, whether through Original Medicare or a Medicare Advantage plan, you won't have to make any changes. The Marketplace doesn't offer Medicare supplement insurance or Medigap policies or Medicare Part D prescription drug plans. So if you have Medicare, it's against the law for someone who knows that you have Medicare to sell you a Marketplace plan. This is true even if you only have Part A or only Part B. The exception is a Marketplace plan through your employer called SHOP if you're an active worker or a dependent of an active worker. SHOP coverage may pay first before Medicare. And if you delay enrollment because you have employer coverage through SHOP, you won't have a late enrollment penalty if you enroll anytime you have SHOP Marketplace coverage or within 8 months of losing that coverage. This does not include COBRA coverage. So when you become eligible for Medicare, you are no longer eligible for any advanced premium tax credits or cost-sharing reductions you qualified for in the Marketplace. If you choose to drop your Marketplace plan, take action as soon as possible. And termination dates are important. If you're ending coverage for everyone on the application, your termination can take effect as soon as 14 days from the day that you cancel, but no sooner than 14 days. Your health insurance company will collect premiums for this final 2-week period of coverage. You can set the Marketplace coverage end date to a day more than 14 days in the future, like if you know your coverage will start on the first day of the following month, and that's more than 2 weeks away. If you're ending coverage for just some people on the application, in most cases, their coverage will end immediately. In some cases, coverage won't end immediately, including when the household members who remain enrolled in coverage qualify for a special enrollment period. As we've already discussed, once you're eligible for Medicare, you'll have an initial enrollment period to sign up. In most cases, it's to your advantage to sign up when you're first eligible, because once you're getting Medicare, you won't be able to get lower costs for a Marketplace plan based on your income, like premium tax credits and reduced cost sharing. If you have limited income and resources, you may be eligible for help paying your Medicare Part B and Part D premiums, and for some, reduced cost sharing for Medicare Part D coinsurance or copayments. And we'll talk about this later. So when might you choose a Marketplace plan instead of Medicare? Again, it's against the law for someone who knows you have Medicare to sell you a Marketplace plan. However, there are a few situations when you can choose Marketplace coverage instead of Medicare. These are if you'd have to pay a premium for Medicare Part A. If you're paying a premium for Part A, you can drop your Part A and Part B coverage and get a Marketplace plan instead. If you have a medical condition that qualifies you for Medicare, like end-stage renal disease, but you haven't applied for Medicare coverage yet, and if you're not collecting Social Security, railroad retirement, or disability benefits before you're eligible for Medicare. Before choosing a Marketplace plan over Medicare, there are 2 important points to consider. If you enroll in Medicare after your initial enrollment period ends, you may have to pay a late enrollment penalty for as long as you have Medicare. And generally, you can only enroll in Medicare during the Medicare General Enrollment period from January 1st to March 31st, and your coverage won't begin until July 1 of that year. So if you don't have or dropped Medicare Part A because you'd have to pay a premium and enroll in a Marketplace plan, you would be eligible for the tax credits and cost-sharing reductions through the Marketplace, assuming that you meet the other eligibility requirements. So terminating Medicare for a Marketplace plan. If you're enrolled in Medicare, you could opt to terminate it and enroll in a Marketplace plan. However, your eligibility for a premium tax credit could be affected. For instance, if you're enrolled in Premium Part A and Part B, or Part B only, you can disenroll from Medicare and enroll in a Marketplace plan. In this case, you could qualify for advanced premium payments of the tax credit or cost-sharing reductions if you meet the eligibility requirements. However, if you're enrolled in Medicare premium-free Part A, you must withdraw your application for Social Security benefits and pay back all Social Security and Medicare benefits received before you could terminate Medicare. In such cases, you would lose your eligibility for advanced premium tax credits and cost-sharing reductions in the marketplace. So you can see this may not be a beneficial situation. If you're enrolled in a marketplace plan and become eligible for Medicare, you can choose to remain enrolled in the marketplace. However, there are important considerations. Once your Medicare Part A starts, you're no longer eligible for APTC or CSR. If you plan to keep both your marketplace plan and Medicare, you should update your marketplace application to reflect Medicare coverage so that your marketplace eligibility can be redetermined. Also, Medicare doesn't coordinate benefits with the marketplace, and your marketplace plan won't pay like a Medicare supplement. So depending on your marketplace plan benefits, they may pay for some services after Medicare pays, but they may not. If you do decide to terminate your marketplace plan when you enroll in Medicare, it's important to time that termination appropriately. If you choose to drop your marketplace plan, take action as soon as possible. You can set the marketplace coverage end date to a day more than 14 days in the future, like if you know your new coverage will start on the first day of the following month, and that's more than 2 weeks away. The Marketplace Call Center at 1-800-318-2596 can help you with that termination to term appropriately. If you're entitled to Social Security Disability Insurance, or SSDI, you may qualify for Medicare. However, there's a 24-month waiting period before Medicare coverage can start. The waiting period begins once you start receiving your SSDI benefits, which don't start until you've been disabled for 5 months. During this waiting period, you can apply for coverage in the marketplace. And the marketplace application process will determine if you'll qualify for Medicaid or for premium tax credits that lower your monthly marketplace premium and cost-sharing reductions that lower your out-of-pocket costs. Your Medicare coverage is effective the 25th month of receiving SSDI. Your Medicare card will be mailed to you about 3 months before your 25th month of disability benefits. And once you're eligible for Medicare, you won't be able to get lower costs for a marketplace plan based on your income. Again, once your Part A coverage starts, you're no longer eligible for any premium tax credits or reduced cost sharing you may have qualified for through the marketplace. That's because Part A is considered minimum essential coverage. You may get health coverage from an employer through the Small Business Health Options Program, or SHOP, based on you or your spouse's current employment. Coverage from an employer through SHOP is treated the same as coverage from an employer group health plan. If you're getting health coverage from an employer through SHOP based on you or your spouse's current employment, Medicare secondary payer rules will apply. You can delay enrollment in Medicare Part B if you're getting health coverage from an employer through SHOP Marketplace based on that current employment. You will have a special enrollment period to sign up for Part B without penalty. And anytime you're still covered by a group health plan based on you or your spouse's current employment, or during the 8-month period that begins the month after the current employment ends or the coverage ends, whichever happens first. Now, if you don't sign up during this special enrollment period, you may have to pay a Part B late enrollment penalty for as long as you have Medicare. And you then can only enroll during the general enrollment period, which occurs each year from January through March, with coverage to begin July 1. While prescription drug coverage is an essential benefit, prescription drug coverage in a marketplace or SHOP plan isn't required to be at least as good as Medicare Part D coverage, or what we consider to be creditable coverage. However, all private insurers that are offering prescription drug coverage, including those marketplace and SHOP plans, are required to determine if their prescription drug coverage is creditable each year and let you know in writing. The rules for marketplace plans to provide information regarding creditable coverage are the same as all private insurers offering drug coverage to Medicare-eligible individuals. If you don't enroll in Part D during your initial enrollment period and your drug coverage was not creditable with your Marketplace plan, you may have to pay a late enrollment penalty for as long as you have Part D coverage. So let's talk about Marketplace dental coverage. As you know, dental coverage is not an original Medicare benefit. However, it may be covered by some Medicare Advantage plans. In most cases, you may not be able to purchase a standalone dental plan through the Marketplace. Now, if the Marketplace in your state is run by the federal government, you won't be able to buy a standalone dental plan. This is because in the federally run state marketplaces, you must have an individual qualified health insurance plan through the Marketplace to also enroll in a standalone dental plan through the Marketplace. If your state is running its own Marketplace, you may be able to purchase a standalone dental plan if one is available, and you would check with your state to determine whether or not this is the case. Individuals may also be able to enroll in a dental plan in their state directly through a dental plan provider. So we know that some people who are transitioning from the Marketplace to Medicare coverage may be concerned because they receive premium tax credits in the Marketplace to help them with their premium costs and lose those when they qualify for Medicare. And they like their Marketplace plan and the advanced premium tax credits they're receiving. However, we want to be sure that they understand they may qualify for some help paying some of their Medicare costs. States have other programs that pay Medicare premiums and in some cases may also pay Medicare deductibles or coinsurance for people with limited income and resources. These programs frequently have higher income and resource guidelines than full Medicaid. These programs are collectively called the Medicare Savings Programs and include the Qualified Medicare Beneficiary, Specified Low-Income Medicare Beneficiary, Qualifying Individuals, and Qualified Disabled and Working Individuals programs that you may be familiar with. Eligibility for these programs is determined by income and resource levels, and the income amounts are updated annually with the federal poverty level. Many states figure your income and resources differently. Additionally, it's important to note that some states may offer their own programs to help people with Medicare pay out-of-pocket costs for health care, like state pharmacy assistance programs, or SPAPs. As you may also know, if you have limited income and resources, you may get extra help paying for your Medicare prescription drug plan costs, or Part D costs. The federal poverty level guidelines are updated annually and determine the income level requirements for people applying for extra help. If you qualify for extra help for Part D, you won't have a coverage gap or late enrollment penalty. You'll also have a continuous special enrollment period to switch plans at any time, with the new plan effective the first day of the next month. So I'd like to wrap up today's presentation with a couple of examples. You'll be able to follow along on your slides. Jim has Medicare Part A only. He didn't enroll in Part B during his initial enrollment period, or IEP. He signed up for Part B in January of 2016 during the general enrollment period, and his coverage began on July 1. Could he have enrolled in a Marketplace plan while he waited for his Part B to take effect? Unfortunately, not in this case, since Medicare Part A is considered minimum essential coverage. Remember, it's illegal for anyone to sell you a Marketplace plan if you already have Medicare. So let's review a different scenario. Barbara works part-time and isn't getting Social Security retirement benefits yet. Her employer doesn't offer health coverage, so she enrolled in a Marketplace plan. Her Medicare initial enrollment period ends next month, and she's eligible for free Part A, but she decided to keep her Marketplace plan and wait to sign up for Medicare. Will Barbara have a late enrollment penalty when she signs up for Medicare Part B? What about Part D? And what else would you tell Barbara? So Barbara can choose to delay Medicare and stay enrolled in her Marketplace coverage if she's eligible for Medicare but hasn't enrolled in it because she'd have to pay a premium for Part A or because she's not collecting Social Security benefits. As we've discussed, before making this choice, however, there are two important points for Barbara to consider. One, if she enrolls in Medicare after her initial enrollment period ends, she may have to pay a late enrollment penalty for as long as she has Medicare. And two, generally she can only enroll in Medicare during the Medicare General Enrollment period from January 1 to March 31. Her coverage won't begin until July of that year. Also, if her Marketplace plan's prescription drug coverage isn't creditable, she may also have to pay a late enrollment penalty, or LEP, for Medicare Part D coverage if she waits to enroll after her initial enrollment period, for as long as she has Part D coverage. Barbara should consider enrolling in Medicare to be sure she doesn't get an LEP for Part B and/or for Part D. She can choose to keep Marketplace coverage and also enroll in Medicare. Although, as we've discussed, it's important to remember that the Marketplace is not a Medicare supplement or a Medigap plan, so there may not be much benefit for her to do so. In either case, Barbara won't be eligible for tax credits and help paying her Marketplace coverage once her Part A coverage begins. So the following slides provide you with resources regarding Marketplace and Medicare, some of which you may be familiar with. This slide provides you with how to keep informed on key dates and information about the health insurance marketplace. There are also a variety of Medicare resources available to help you learn more and answer any questions, and those are included on this slide. This training module is provided by the CMS National Training Program. To view all available CMS NTP materials, including additional training modules, job aids, educational activities, and webinar and workshop schedules, or to subscribe to our email list, please visit the website on your slide. And with that, I will conclude today's presentation. Thanks for joining me.